Welcome back, all of you. Next, we will continue with other topic, that is male infertility. So, as you know, infertility means inability to um, have a conception. So, in case of male, it goes like this, in which a regular unprotected sexual intercourse does not result in pregnancy. That is even over a 12-month, 1 year period. It is commonly due to the deficiencies with semen, maybe decreased amount of semen, or the semen which is having a less amount of sperm. It is classified into primary as well as secondary infertility, in which primary infertility means a couple who has never had a child. Secondary means at least one conception has been occurred, but currently the couple is not able to achieve pregnancy. So what are maybe the causes as well as risk factors? So it can be congenitally occur, or it can be acquired during the lifetime. So it is divided into three concerns: pre-testicular causes, testicular causes, and post-testicular causes. So under pre-testicular causes, we can see the first heading is hypothalamic disease. The diseases like gonadotropin deficiency, which is seen in many congenital disorders like Kallmann syndrome, isolated luteinizing hormone deficiency, as well as follicular stimulating hormone deficiency, or gonadotropic syndromes, any of the gonadotropic syndromes. These are the hypothalamic diseases. Next one is pituitary diseases like pituitary insufficiency, which is occurred due to tumors, operations, radiations, or it may be due to hyper or hypothyroidism. Some kinds of medications like chemotherapy, specifically steroids, and some kind of diuretics, spironolactones, cimetidine. All these can affect spermatogenesis. Some drugs can decrease the follicular stimulating hormone, like the drug called phenytoin. Some drugs like sulfasalazine as well as nitrofurantoin, which is antibiotic, which is able to decrease the sperm motility. So different according to the different medications, the effects will be different. So those are the pre-testicular causes. Now the testicular causes of infertility. Most commonly, some of the chromosomal abnormalities like Klinefelter syndrome, XX syndrome disorders, as well as XYY syndrome, Noonan syndrome. So many syndromes is associated with this infertility. Besides that, drug, radiation, or male genitourinary problems like cryptorchidism, orchitis, some kind of trauma to the genitourinary system, systemic disorders like it can be hematological issues, renal issues, as well as hepatic diseases. Defective androgen synthesis or action, varicocele as well as hydrocele, or any kind of neoplasms like seminoma. What do you mean by seminoma? So let me ask you this to Blessing. Blessing, tell me what you mean by seminoma. You have to message to inform me through WhatsApp. Or it can be semen abnormalities like azoospermia, which means absence of sperm, and oligospermia means decreased number of sperm. This you too can expect as a multiple choice question. What is azoospermia as well as oligospermia? And coming to the post-testicular causes of infertility like vas deferens obstruction, infections like prostatitis, anti-sperm antibodies. The antibodies which is originating against or acting against semen or sperm. Retrograde ejaculation. What do you mean by retrograde ejaculation? In which ejaculation happens but it will not come out. Instead, it will go back to the bladder. So that is retrograde ejaculation. Or other causes included in post-testicular concern is ejaculatory duct obstruction, hypospadias, impotence, maturation defects, any of the immunological disorders, sexual dysfunction itself. We have studied the sexual dysfunction. Systemic diseases like high fever, infection, as well as kidney disease. So these all are the causes of infertility. It is classified into congenital as well as acquired. and more commonly it is again categorized into pre-testicular, testicular as well as post-testicular. Nowadays actually infertility is a common thing which we see in the society. So this question can expect as a 5 mark question, even though the university has not, the syllabus has not prescribed as a short note, but I think this we can expect as a 5 mark question. Other factors affect sperm productions are overheat in obese man as well as due to the occupation. So can anyone tell which occupation is risk to this infertility? That means which will produce overheat. So anyone who knows can WhatsApp me. Very frequent intercourse can lead to demand exceeding. So over sexual activity is also affecting in a negative way. Smoking over 20 cigarettes a day. That is also shown. So many studies have shown this results. Decreased amount of sperm count and excessive alcohol intake. So these are the causes. Now coming to the pathophysiology is easy due to the etiological factors. What are the etiological factors? It can be pre-renal, testicular as well as post-testicular causes, which will lead to hormonal imbalance between hypothalamus, pituitary gland as well as testis. All these three areas may be affected, or one area or two area or three. It will interfere with the production and maturation of the sperm. It will ultimately affecting the spermatogenesis, which will decrease the production of effective sperm and leads to infertility.